Hello, it's Dr. Rhonda Johnson. Today is Sunday, April 2nd, 2023. Well, April is National Minority Health Month. So throughout this month, I actually am going to be addressing the health of people of color in the United States. So today I'm talking about COVID, racial differences in COVID deaths, and in long COVID symptoms. But first, I want to discuss the distribution of COVID-19 deaths in the United States as of February 1st by race and ethnicity. The data that I'm sharing comes from the Statista website. And as of February 20, 2023, around 66% of all COVID deaths in the United States have been among non-Hispanic whites, who account for 60% of the total United States population. Now, Hispanics account for 15% of all U.S. COVID deaths, and they account for almost 19% of the total of U.S. population. Now, non-Hispanic blacks account for 14%, almost 14% of all U.S. COVID deaths, and they represent 13% of the United States population in total. And non-Hispanic Asians have accounted for just 3% of all deaths due to COVID-19, even though this group makes up almost 6% of the entire U.S. population. So that's the data that I got from that website. And that shows the distribution of deaths from this novel coronavirus in the United States by race ethnicity. Does any of it surprise you? Now, death is not the only way to measure the impact of COVID. Long COVID certainly is a major disabling event for some people after COVID infection. And new research from the National Institutes of Health suggests that Black and Hispanic Americans are more likely than white Americans to have symptoms of long COVID but not be diagnosed with long COVID. In addition, specific long COVID symptoms may vary. Now, I'm talking about an article that was recently published on March 6, 2023, and I will share the reference. Now, in this article, they found that Black and Hispanic adults were more likely than white adults to be diagnosed with these symptoms of long COVID: diabetes, headaches, chest pain, and joint pain after COVID infection. But Blacks and Hispanics were less likely to have sleep disorders, cognitive problems, or fatigue, which are more common in white people. Now, researchers do not understand why these findings have occurred, and I wanted to say that these clinical manifestations of long COVID were based on a study of COVID patients who were treated and followed from 5 academic medical centers in New York City between March 2020 and October 2021. Now, I don't know if it's going to be representative of the entire population of people here in the United States, and this study only looked at the medical records of about 62,000 patients. But nonetheless, I thought that was interesting, and it was the first study that I have read that talked about differences of COVID symptoms, long COVID symptoms, by race and ethnicity. So that's my message today. Share your thoughts, and as always, take care and be well.